Well, good afternoon, everyone. We'll go ahead and get started. And welcome to Black History Month event. This month's event, we're going to have a fireside chat with Dr. Keith Dempsey, and facilitating that conversation will be Rachael Banks from the Oregon Youth Health Authority, Public Health Director. I am forgetting my brain right now. Again, Brianna is operating all the technical. So if you have any technical challenge, please just text us or email us. Please keep your phone on mute. And then I'm going to go ahead and turn it over to Rachael so that she can introduce herself and Dr. Keith Dempsey. And welcome. Thank you all for giving up your precious time. Rachael, I know how busy you are, as well as Dr. Keith Dempsey, and we all really appreciate it. And I'll turn it over to you right now.
Thank you, Ms. Serena, and welcome everybody. So Black History Month, it's an honor to be here having a conversation with Dr. Keith Dempsey. And it's going to be a great conversation, listening to his thoughts and wisdom. I was asked to start off by just sharing a little bit about who I am, the work that I do, and how I've come about. So Rachael Banks, I use she, her, and hers pronouns. I was born and raised in Oregon, grew up in Portland, went to Jefferson High School, go Demos, and got into doing public health work. Right now, as Ms. Serena said, I'm the public health director for Oregon Health Authority. I got into doing this work really coming from a behavioral health background and studying psychology. And in the course of that work, somebody introduced me to public health and this idea that the looking at the health of populations, and at that time it was HIV, and I had heard that HIV impacting Black people. And at that point, I hadn't heard that before. And so it really got my mind thinking about, wait a minute, how do we know that a group of people is being disproportionately impacted, but we're not talking about it and we're not having culturally specific strategies? So that really got me into public health, although I didn't know that that's what it was at that time, and have been fortunate enough to continue to work on issues that impact Black communities here locally, from chronic disease to all sorts of things. Got to work with the Healthy Birth Initiatives and Achieve and Reach, and always working at those racial and ethnic approaches to community health. And I think the one thing I would say, and be curious as we have this conversation, Dr. Dempsey, is that really one of the things that stood out to me in all of the different ways in health that we categorize people is that we're asking our communities to come to us in deficit. And oftentimes we're asking them to be categorized, whether it was like, are we talking about your diabetes today? Are we talking about, some behavioral health diagnosis or whatnot? And just in the work and working, particularly in a culturally specific way, I think back to our days working at the AfricanAmerican Health Coalition. I don't know if you remember that, and the ways in which those culturally specific approaches start with the brilliance and resilience of community and start from culture being a healer. And so that's what I'm really excited in that we're having this conversation today. And then of course, bringing forward always that, the Black beauty and resilience. And I know that you've done that work too, Dr. Dempsey. So I'm gonna pause there. I hope that meets your needs, Ms. Serena and crew, by way of introduction. And I'd love to just start off with you, Dr. Dempsey, talking us through kind of your background, what you do, and how you got to doing what you do.
Okay, thank you. Can you hear me? Can you give me a thumbs up? You're going to be my guidepost there. Okay, thank you so much. Dr. Keith Dempsey, pronouns. He is I is him, slim with the tilted brim. Happy Black History Month to all of you. Thank you for sharing this virtual space with us today. Raised in Portland, Oregon, born in Buffalo, New York, but I was raised in Portland, Oregon. I claim Portland, and I went to Benson High School. At Benson High School, at the time I went to Benson High School, there was an uptick in shooting and violence, and the North and Northeast community was deemed a negative place. But I know the North and Northeast community to be so precious to me. So I vowed to go on to college and to be able to learn positive things and bring them back to a community that people seem to be so negative. And that's what I did. Went on to Oregon State University, and I came on back. It's important for me to say that I have over 25 years of working in the mental health area. And before I went back to Oregon State to get my PhD, I cut my teeth in the profession at some very, very cool places. Worked at the Children's Farm Home, worked at Self-Enhancement Incorporated, as mentioned, worked at the African-American Health Coalition. Then I landed at George Fox University after I got my PhD and had some success there. I operated as the Associate Dean of Counseling. And it's also, I'm really proud to say that I am the only African-American to receive tenure at that institution. So I had success there to the point that even a year ago, I was offered a promotion to be Dean of Social Work and the Dean of the School of Counseling. And I started to realize that the higher I got in the university, the farther I was going from my community. And here we are in the middle of a mental health crisis. And it didn't sit well with me. So I gave up the university and this small private practice that I used to have on the side. I expanded that practice. The specialty is racial trauma. In addition to that, I have a team of Black clinicians, and we offer various trainings in the community with the uptick in violence, and the loss, those who are on the front lines, our medical workers, our teachers, folks in the social service agencies are experiencing great trauma and loss themselves. So we've created the training, and we provide trainings to help those folks deal with that. In addition to that, we have trainings that teach and coach mental health professionals and get them up to speed and increase awareness and increase their awareness in terms of cultural sensitivity and cultural humility. And other than that, I'm a father. My wife is the flyest sister in the world. I have 2 wonderful sons, and I'm just committed to this community. And I just thank you for having me today.
Well, thank you for that. We definitely are so proud of you, and talking about the pouring back and the giving back, and knowing that you're giving back to that next generation through work with your sons and at school, and with community children and elders all throughout. So just sitting here with this, just once again, such pride and admiration to you, and coming back and continuing to pour back and making that transition up and having success and reconnecting and being closer.
Yeah.
Kind of to that, you talked about your work in training up a workforce, in addressing racialized trauma. How would you answer the question, does diversity, equity, and inclusivity include mental health?
I was in a meeting prior to this one just now, and I heard someone say equity, diversity, and inclusion is not a passive body of work. And then the brother went on to say, the work is done to repair harm. So when you think about it, in any discipline, when diversity, equity, and inclusion is not included, folks who have power and privilege, or folks who don't have power and privilege, are pushed further in the margins and are treated unjust. So the A answer would be absolutely yes. Counseling, mental health is supposed to have all of that stuff. But the harsh reality is that we have to ask that question. And as I say that, I look at the ACA, the American Counseling Association's Code of Ethics, and everything in their Code of Ethics points to DEI work, DEI efforts are welcomed. DEI efforts are supposed to happen. This is what you are supposed to do as a counseling professional. I'll even go on to say the CDC has declared racism as a threat to mental health. Now, this all sounds good, but we're asking these questions. We're having this conversation because we have to ask, are we doing a better job on paper than what we're doing really, in practice? So as it relates to mental health, and especially Black health, there have been historical challenges. And Sister Rachael, when we talk about the challenges, everybody wants to point to there's a stigma in the Black community about mental health. Now, hear me and hear me well. There is a stigma. There is a stigma that, we'll go to our church before we go to mental health. There is a stigma that we, some folks believe that counseling is for white folks and not Black folks. I think we have to stop and recognize where that stigma came from. That stigma came from systems that provided fear that we in turn said, no, that's not a system for us. Let me talk about this just for a little bit. In the greater medical and mental health community, there's always been a history of racism and mistreatment among folks of color. The US government supported experimental surgeries and studies on Black people. We all know about the Tuskegee experiment. And there are experiments and things far beyond Tuskegee. We know about the Tuskegee experiment. Now, some folks say, well, people don't even remember what that is. They don't know the nuances, the intricacies of that. It doesn't matter. What we need to understand is that when something happens like that, that's so egregious, so inhumane, so manipulative to one people, it has a long-lasting effect. And it's affected our community. This is what scholars call something, well, they call it cultural mistrust, a mistrust of a system that's supposed to heal. Now, when you think about trust, it seems like a simple thing, but it's not. I see you sitting there, Sister Rachel, and wherever you're sitting, if you were sitting in or that seat that you're sitting in, if you didn't believe that that seat can hold you, if you didn't believe that it was firm enough, you wouldn't sit in that seat. So that's what happens. We have a system that we don't trust, and you don't use a system that you don't trust. It just doesn't happen. In addition to that, we got to look at affordable healthcare, access to affordable healthcare. It's always been a problem for Black folks, even here in Oregon, and also performances, as it relates to, how Black folks, say, the outcomes. They say that they got poor outcomes from, when they go to therapy. Oftentimes, even here in Oregon, the narrative is that OHP is like a lower tier insurance. So what I've done, I've dedicated my whole entire practice to OHP insurance. And I'm working with Care Oregon, working really close with them to bring on other Black therapists and providing a great quality of care so that folks can be able to see someone who looks like them as they come on and receive therapy. So when you ask, is diversity, equity, and inclusion, should it be part of mental health? Those are some of the reasons that I say yes, and those are some of the questions that I think that we should be asking ourselves.
Yeah, absolutely. As you were talking about both, Oregon's history, the difference in multiple professions between the espoused values and perhaps where we are in terms of what actually happens, what we're seeing in paper and what we're seeing on the ground. What are those outcomes? What are the receipts, for example, that we would need to see in mental health to know that the values, the commitments of DEI are benefiting the folks on the ground getting those services? What are the things that you look for in terms of working with and that progress and outcomes? And this is a multiple part question, but also thinking about in working with Black therapists and Black people, what do you notice about how that representation changes the experience and the outcomes that you all are able to get to in partnership with your clients?
And the way I'm going to answer it, both of those are probably going to be together. When I first started working, and it was with OHP, and one of the folks who I was working with came and said, wow, Dr. Dempsey, this is incredible. I mean, folks are just really loving it. Folks are leaning in. And so I said, wow, okay, is there some type of secret evaluation that you all are doing, with, my clients? And he said, no. I said, well, how do you know that it's working? He said, I've never seen Black folks attend therapy the way they do. So, Sister Rachel, guess what I'm saying is, oftentimes, and this is what I've heard, that, Black folks who try to go to therapy and try to attend with somebody who is not a cultural match, they'll go one time, maybe two times, but not get what they need. And end up leaving for whatever reason. So those are the markers that I see, that people are going, they're staying, because if you go and you stay, that means that there's a level of trust, that means there's some safety, and that means that there's some healing happening.
That's great. And what do you think kind of in the field is needed to stay? I'm sure the environment that you're providing for your colleagues is intentional in that way, but I can only imagine too being anytime, you know, when you're talking about the first Black this and the first Black that, that experience of going into a field that's not representative has that impact on the helpers. And you also talked about in your intro, just seeing the folks that are in helping professions, the trauma and the load that they're carrying as well. So what does the field need to be more inclusive and to support those folks who are carrying an extra burden, both because of their own lived experience and who they're working and serving on behalf of?
Okay, so now we're talking about inclusivity. How do we make this more inclusive? Is that where we're going with this?
That's where we're going.
Okay. So walk with me on this. As I answer this question, I want to give you a little context about how I see inclusivity through a mental health lens. And I love metaphor, so stay with me. I would say inclusivity is this. Inclusivity should provide all of my Black clients the keys to the house of wellness. So what that means is that they can come in and they can hang out on the couch. They can lay down. They can kick their feet up. They have access to the remote control. They have access to the music. They can watch whatever shows that they want to watch. They can listen to whatever they want to listen to. They can go to the refrigerator and eat what kind of food they want. They can do whatever they want to do. They can practice their culture and be their beautiful Black selves. Now that sounds so inviting as I paint that picture. And that's what we need to do. We need to make mental health more inviting to everyone, especially Black folks, because we're centering Black people today. It can't be a house that only Serena listens to her music, or only Rachel, you know, watches the TV, or only Keith is listened to and respected. It has to be a place that centers and honors our cultural and racial specificity.
And how can, you know, in that, and I love that metaphor, right? Because it is inviting. And I think that that's so often as we're talking about the work in diversity, equity, and inclusion, where I think what's missed is the beauty, the benefit of how this benefits us all when we're all able to come into that house and be our full selves. Yeah. And I think, you know, it's about wellness and the keys to that. So I love that metaphor and the keys to that. How do we also, in addition, create that inclusivity with, so that, you know, folks who are serving feel included? And then also, you know, just what advice do you have? And this is kind of going to some of the healing and how to bring that cultural healing into the spaces. I mean, I know we're here talking, you know, at the state of Oregon, and we have a variety of people attending. How does the state of Oregon create that inclusivity? What should we be looking at and focusing on for the health of our communities and the health of our each other?
Yeah. So how can we be more inclusive? I kind of already spoke about the systemic changes that need to happen, but there's also some work that needs to be done on the ground level. Research will tell you that, you know, folks want to see someone who is a proper cultural fit, number one. Number two, someone who shares and understands their values and traditions. Here's the deal, Sister Rachel. We are in Oregon. And oftentimes what that means is people want to see somebody who looks like them. But because we are in Oregon, we can't ensure that there are going to be enough Black therapists to provide this service. So with that being said, it's incumbent upon all mental health professionals to lean into cultural sensitivity. Taught at George Fox, and I was talking to one of my white students about this very subject. And I remember this particular student just grew, just leaps and bounds. And at the end of the class, he came to me and he said, you know, Doc Dempsey, I learned so much in this area. And he said, man, after this class, I don't know if I'll be in a room with another Black man for another 6 months. And so we began to have this conversation about how do you continue to sharpen that blade if your worldview, if the folks who you're around, if you're not doing something intentional to be able to do that. So we had this conversation about intentionality, taking more than just the 2 classes that they provide at the university around multiculturalism, being able to put yourself in different settings, being able to read different things, being able to look at documentaries that maybe you wouldn't have to, or maybe you wouldn't look at because you have the privilege and you don't have to look at it. This needs to be done in order to do this well. Because when it's not done well, what happens is I hear clients say, Dr. Dempsey, I was with a white therapist. The therapist was well-meaning. However, I spent half of the time explaining and I spent half of the time teaching, which left no room for healing. And that's not a good thing. And that's not a good thing. And folks feel like it's more like an academic experiment. And when people start saying things like that, it feels more like an academic experiment. And then we start to remember Tuskegee and some of those other things. And then you say, okay, I shouldn't trust this. I need to leave. And then folks aren't able to get their healing. I want to be able to go to therapists and talk about my cousin Pookie and talk about how he showed up to the barbecue with a curl cap on and house shoes and not have a therapist that is worried about, is Pookie his real name? Why do you have house shoes on? And I don't want to explain what a curl cap is. And if I take that further, Sister Rachel, I don't want my cousin Pookie to be microaggressed, because I don't care how you see Pookie, he might be a pillar of the family and somebody who I trust and I love. So, we need systemic change in addition to training and awareness on the front line. And I hope and pray that those things are happening. And while they're happening, it's my life's work to encourage other Black helping professionals to become therapists and join the field. It's said that the harvest is plentiful, but the workers are few.
Thank you for that. Listening to your comments around intentionality, just really thinking about how important that is in a place like Oregon, whereby, we are wanting to narrow the gaps and make sure that all folks can step into their full wellness, and acknowledging a history that hasn't happened. Right. And I think that there's that tendency of how do we do the best for the most. And that just kind of continues to leave people in the gap. So as you were talking about that intentionality, it gave a lot of room for just thinking about how you apply that in a variety of settings, the classes that you take, the folks you seek out, the ways that we can be unafraid to appear to be investing or seeking out, let's just say, Black employees and saying, we want to develop you, we want to pour into you the ways that we were poured into from that community perspective, and being intentional there, right? That in order to, as you said in the beginning, this isn't a passive endeavor. In order for us to reach some of those inclusivity goals, there has to be that intentionality, and what does that really look like? Absolutely. Yeah, I'm curious, we've all been through these years. I mean, on top of for Black folks, there's years and years and years of but people talk a lot about what's the new normal, and the impact of the pandemic, and what's the impact been of some of the social disruption, whether that's our faith houses maybe being shut down or moving to different protocols, and trying to manage family events with a smaller amount of people, and all of those. I mean, kind of just your general thoughts about how do we take these experiences and move towards healing as a community. And then I'd really like to narrow into, like, as employers, as we support each other and family, like what are your thoughts on where we are and what we should be thinking about as we're recovering and moving towards resilience from COVID?
Yeah, let me talk about the employee situation first, because it kind of struck me there when you said, the new normal. So when I think about, employers and how they can support folks as they come back to the new normal, and how they can be empathetic about when folks are returning, the first thing they need to do is realize that there's been nothing normal about these last 2 years. Absolutely nothing normal. And when folks lose sight of that, that's when they can't be empathetic about where folks are. We can't lose sight. As you mentioned, COVID-19 stopped the world, shocked the world. We can't lose sight that our faith, places of faith were shut down, and we had to do faith very different. We can't lose sight that education looked different. I was my son's 7th grade teacher. He didn't like that too much. We can't lose sight that the economy crumbled and people just didn't know what to do. We can't lose sight that racial tension was at its very highest with the murder of George Floyd, which was new to some people. But for Black folks, we've seen thousands of George Floyd. What was different is that our mourning wasn't done in private, it was done in public, which added an extra layer. We experienced loss that we have never seen before. Some of the kids in the community, they hear left and right that someone is dying, of COVID, that someone has gotten shot in our community. Our own physical health has suffered. We sat more, we worked more, we ate more, and we moved less, okay? And we had the competing feelings of trauma, anxiety, depression, and it surfaced like none other before. So we can't forget that. Our employers can't forget that as folks come back. And they need to be able to create a safe place for folks to do that. As you talk about this, employees, should they make health a priority? Absolutely. Should they make their mental health a priority? Absolutely. And I say that is because we are all we have. We are all we have. In the African-American community, as you know, we say, we're just going to keep on keeping on. We are just going to keep on keeping on. And it reminds me of a commercial that I saw. It was in the beginning of COVID. And it said, we can't stop living. Our living just has to be a little different. So the pivot and shift and the ability to move, we've got to make sure that happens. I think about the stress, that we've experienced. I don't know about you, but if you've gone to the grocery store, you realize that there are 12 aisles and there are only 2 people that are checking. I mean, so people are so stressed out. In the beginning of the pandemic, they said, I'm upset because I don't have a job. And now people are so stressed out that some don't want to work. So I throw this back on the employer. They need to make sure that there are proper services provided for mental health services, whether they be individual sessions, the constant check-ins. I happen to be in a meeting with Joe McFerrin. He's president of POIC, and he was going to dive in. He had his leaders all in a meeting. He was going to dive in and just get right to the agenda, and he stopped. Because the folks that Joe works with, when people get shot, they're the first on the scene. And Joe said, let me just slow down just a little bit. Man, I want to check in. How are y'all doing? And everybody said, oh, we're good, we're good. He said, no. How are you doing? And Joe spent a half an hour just talking to his leaders about how they're doing, whether they were stressed, whether they were traumatized, whether they needed support. We need to be able to do that. In addition to making some accommodations, I hear, this might be a rumor here, but it sounds good, so I'm going to say it anyways. Nike has something called Zoom Free Friday. I love it. I love it. I love it. I mean, so whatever it is, to be able to hear from your folks. But most importantly, I think the thing is to listen to your employees and believe them. Listen to them and believe them, and to be able to shift and pivot like we all had to do, in the community.
Yeah, thank you for that. Just so many nuggets and things that I know we can take. Before we turn it to see what sort of audience questions there are, just wondering for folks who are helping, as they see the magnitude and the need has grown and the workforce has shrunk and all the things you're saying, and you talked about, sometimes people use the analogy of put the oxygen mask on yourself before you help other people. What's the word that you have to the folks who are here, to our workforce, about how to, while the sense of urgency is increasing based on the need or the work or what the foregone treatment that people need, or all of those things, to I don't know if it's give permission to yourself to do that to have that space. And I appreciate that you said, here's what the employers need to do to create the space and the supports from the employee side, from those of us who are just, I got more to do, got to keep moving. What's your word to us to put it in perspective and focus more on that self-care piece?
Absolutely. As I started with the employers saying, listen, and it's important for me to start there and say, hey, folks, you need to listen. Then I can follow up and say, ask for what you need. Because if folks can ask for what they need and they have an employer that's listening and empathetic, okay, then that person can get what they need. Pace yourself. Pace yourself. We can't do everything at once. And when you come back to this workforce, it's going to look a little different. You might be overworked and understaffed. I see that in so many places. I think I was shopping in H&M, and they have the men's side and the women's side. And there was one guy in the whole store, and the store was busy, and he was running back and forth. And there were people who were leaving, and we're hearing the alarms go off. And he said, I just can't do both of these sides. And he shut one side down. And he said, I'm going to do the best that I can with what I have. And I think sometimes that's what we have to do. We have to slow down, and we have to do the best, that we can with what we have. Simple things, breathe. Just stop and breathe. Just like that. Just stop, just stop and breathe. And also, I think the physical movement, we don't have that as much as we have. It's important to be able to do that. All you need is a pair of tennis shoes. All you need is a pair of tennis shoes to go walk around. And people say, well, I don't have an opportunity to go to the gym. It's not like you have to go to the gym. When I worked at the African-American Health Coalition, there was one lady, and I used to see her every time she had a break, every time she had lunch, I would see her fly by my window, and she would go for a walk. And by the end of the day, she had walked at least 45 minutes. So to find some way, whether we're stretching or doing whatever, and now, we have classes, we have things online. So, some of the things, they're bad, like, I can't get to the gym. And then others are like, okay, well, this, is more convenient for me. So take a deep breath, pause, do what you can, and ask for what you need.
Thank you. So helpful. I know we have some questions that are coming in the Q&A. I wonder, Brianna, is that you that's going to help us move through these, or actually let me see here. So let me ask you a question, Dr. Dempsey.
Sure.
How do you feel being called, this is from the audience, being called an African-American when we are in the Olympics and represent America in the games?
How do I feel being called an African American?
Yep. Yeah.
Well, that's a title that, I think the term Black works for me, because the term Black for me is inclusive of my Haitian brothers, my African brothers, so on and so forth. Me personally, I want to be identified as African American. I want to be identified, as Black, because it's too often that we are invisible and we're not seen for the things that we do and the contributions that we make.
Thank you for that. Another question. And people please keep populating the question box. So there's a question here. So through a lens of equity and inclusion, many drug laws and also mandatory reporting rules for child welfare end up targeting and overrepresenting people of color and all people who live in poverty. What can Oregon Department of Human Services do to help reverse this inequity?
You know what? There are times that I don't get out of my lane, and and I see things through a mental health, perspective, and I know that is a very important question. as it relates to, what that does for mental health for folks, I'm aware that, that puts us in a very tough position. But these are some of the things that I would work with legislature and some leaders in terms of, being very strategic about moving towards that.
Yeah, I appreciate that. I was thinking as you were talking about just some experiences I had working with healthy birth initiatives and parenting, and where this issue would intersect just in terms of how systems see parents and Black parents.
Yeah.
And just how beneficial it was to be working with Black therapists, to be working with Black nurses, to be working with folks who started out those interactions from a place of assets, from a place of belief in those clients. And it's just one of the things that stood out to me in terms of just the bias inherent in folks. And then when in these various fields, how we see that obviously play out from the systemic, the laws placed down to all of us. What are the sort of things, if we're working in these sort of fields, not the field specifically, but that bias, when you talked about Pookie and how important Pookie would be and all of that, I think that was an example of how having therapists that are starting out from that place of not judgment and understanding can help. Just wonder if there's anything you can offer for us in kind of our own work. In terms of going to a therapist, or? In terms of that bias and addressing that bias that I think underlies some of the individual decisions. Obviously, there's racism that's underlying policies and all that, but for folks as they're working day to day and making determinations and working with families, what are the things that we need to be thinking about to keep working on that bias? What's that intentionality and that cultural humility and sensitivity needed there? Well, in order to have cultural sensitivity and humility, you've got to get outside of your own box. I mean, because we all have a worldview. You've got to be able to talk to some different people, read some different things, do some different research in order to expand your worldview. Oftentimes we're comfortable where we are. And that means that we don't see other things around us. So, my answer is the same. You've got to do your homework. After George Floyd was murdered, I was interviewed on a news channel, and folks were asking the questions. Well, what do you do? How do you do? Do I talk to my Black friends? And I was saying, you know what? You all need to do your homework. This is all documented. It's there. You can have conversations with people, but the onus is on us as individuals to be able to reach out and expand our worldview. Yeah, thank you for that. See, lots of questions coming out in the chat, so appreciate that.
I can help you, Rachel, too.
Okay, sweet. What are you seeing in there, Ms. Serena?
Let's take one. It says, when you talk about pouring out in the context of giving yourself as an African-American provider to the community, there has to be an amount of strain that is put on you, meaning sometimes you just can't do it all. What do you do to refill or pour back in to keep yourself going? And I think that could be for both you, Dr. Dempsey, as well as you, Rachel.
Yeah. That's a fabulous question. Yeah, as I, think about, why did I come back to the community? Why did I expand my practice? I expanded my practice to serve the community. But, as you asked that question, Serena, I can't continue to pour in everyone else's cup if I'm not getting, things poured into my cup. So I have to be, really honest about my self-care. I have to be honest about setting boundaries. I have to be able to do all of those things and understand that, I need to pace myself and breathe and that I can't do everything, and be really intentional about what it is that I do. I can run out here and try to see every African-American person, but that's not possible. But what I can do, I can mentor other professionals who are coming up, and they can see, 20 to 30 people. And that way, you work really, really hard and smart.
Rachel, do you want to add anything to that too?
No, happy to. We've been thinking a lot about this, right? And hence one of the questions I asked Dr. Dempsey. I mean, I think for me, one of the biggest things is fighting the internalized racism and the voice of the pressure that goes, you have to keep working, you have to whatever, you're the first Black public health director in the state of Oregon, don't mess this up for everybody else. And so it's realizing that first of all, that's the gaslighting of racism, that we've never actually worked less or less hard.
Yeah.
And so sometimes it's really doing that self-work and coming from that place of self-love and judgment and thinking about it differently. Someone said, and then there's people who will care and love and is listening to those people when they ask. I think about Ms. Charlene McGee is somebody who I've worked with, and she'll always say, what are you doing to take care of yourself, Ms. Rachael? And it's like, okay, right, let me stop and think about what am I doing? And folks who've talked about this concept is of rest as revolution. And knowing that if we don't stop a system that has worked us literally to death, that we can't then give back to pour into community. So it's creating that space, and then really being intentional about that rest is something that I think is really important.
Yeah.
Okay. Another question. I realized that with my childhood growing up with gang members, that I have never had a therapist understand. It's always a teaching hour for me, and I see the bias that comes with it. I would love to talk to someone who understands Latino gangs and the good and hard things that come with it. Thank you for helping me understand this need. Do you know therapists that would fit this need? Thank you for your work, the work you're doing.
Okay, and whoever that is, if they can reach out to me, and I have a few folks. And here's the deal: this is why this is so hard. I'm excited that Black folks, that brown folks are coming to therapy for the very first time, and I'm saddened that there are not enough Black and brown therapists to be able to meet the need. But what I do is when folks reach out to me, I do my best to try to connect them with folks. Now, it may be a situation where there's someone who knows a little bit about, being part of a gang, but not necessarily a Latino gang. And I would hope that therapist would be open and say, you know what, I don't know the intricacies and the nuances of a Latino gang, but I know something about, being in gangs. That's the person that I would get down with. I wouldn't get down with the person that's faking the funk and asking you all of the questions and not doing the research and not trying to lean in to your experience. So please, so if that person could just reach out to me, and I will do my very, very best to connect you with someone.
I just want you to know there's a lot of questions in here, and we're not going to get to them all, everyone, but I'm going to get to some of the harder ones. Okay. This one is the house you spoke of earlier, where you want to create a place where Black people come and can be at home. My question is that house you see a house only for Black people, or do you envision it being a house for all races and color to enter and be at home? I sit and think a lot about how to honor the Black community and fight for equality and inclusion. But then, does that include creating programs and groups for only Black people, or is it a program or group that includes all races with an emphasis on Black people? It kind of speaks to when you refer to wanting to be referred to as a Black or an African American.
I am all about centering Blackness. I am all about centering Blackness. I am pro-Black, but that doesn't mean that I'm anti everything else. So when I talk about going into that household, I mean, everybody has the keys, but oftentimes we don't have the key. We got to knock on the door. Maybe sometimes we can get in the back door, and we don't have access to the services that everybody else has. I just want folks to be able to be themselves wherever they are. You think about it, if therapy is the house, and the other person that said, whenever I go to therapy, I'm explaining, well, you go in the house and you don't have access to everything. You don't have access to the healing. But to answer that question, I am all about centering Blackness.
Great answer. And great question too. What advice would you give a non-person of color that want to do a better job of being sensitive to their Black and brown friends and family members' mental health needs, and do a better job of recognizing that inherent trauma that they experience simply by virtue of living in the skin that they live in? Great question.
So It is a great question. And, and we need to move beyond rhetoric, because sometimes we learn a few terms and, microaggressions and so on and so forth. I mean, so that's dinner party talk. Let's move past the dinner party talk. Let's have real conversation. And the onus is not on our Black friends. The onus is not on our brown friends. Now, it's respectful to be able to talk to them, but at the same time, we've got to be doing some work outside of those conversations. And oftentimes, folks feel like, okay, I deserve a pat on my back because I am trying. But this is something as a counselor that we should do. It's in the code of ethics. And if this is something that you really want to lean into, it should be part of your practice. You should be looking at things, a little different.
Thanks. And Rachel, I think this is mainly for you. This kind of for you too. This question, it says, mental health professionals are in very short supply, and seemingly, especially through OHP. Is this a priority at this point to remedy? I feel like it's almost impossible to get into a mental health office for help at all. So it feels like having a cultural fit. Cultural fit is pie in the sky.
Yeah, I mean, I'm happy to talk about some of the pieces. I think that that's definitely an issue. And as Dr. Dempsey has talked about, one of the unfortunate realities of where we're in. I think from the conversations that we're having from the Oregon Health Authority perspective, is about having supports and peer supports really across a spectrum. So I know that there's a lot of efforts and new investments and things like ballot measure 110 and getting folks to the table and getting communities who've been left out of the decision making into the table in terms of how do we make these investments to really increase Black and brown providers and diverse providers across the spectrum. And I want to acknowledge where we are right now, and that folks that there's not enough people in Oregon. But I think it's various levels of healers and helpers is one of the ways that we're looking at it, and also the role of peers and mentors and therapists and psychiatrists, like all the way throughout are things that we're working towards. Yeah. I'd be curious on that question for you, Dr. Dempsey. What are your thoughts?
Well, and here I am, I'm on the ground level, and really proud of this connection that I have with Care Oregon. So I'm going to be working really closely with Care Oregon on this specific topic, because there are some therapists out there, some Black therapists that I know that aren't connected with OHP. So we're looking at those reasons. Why aren't you connected to OHP? What is the history? What have you heard? What can we change? And we need to bring you on because we have folks like that who are saying, I need to be connected with that therapist. So it's in works. And, it seems like, if we're working from it and we're pushing from both angles, from all angles, perhaps maybe we can get there.
Okay. I'm going to go ahead and read this one, and I hope I get it right. If not, they can email me and let me know, Serena, you got it all wrong. But it says, COVID-19 impacted white people in ways that threatened our privilege. Everyone experienced more barriers to accessing services/resources, and churches closed, etc. How did white rage, resistance to conforming to restrictions of COVID regulations affect Black people? How did it affect Black wellness/mental health when white people were more angry about mask mandates than racism?
I'll say this. In our fields, trauma is a big thing. Everybody's like, trauma this, trauma informed. Listen, we have always experienced trauma as Black folks. We are not new to this. We are true to this. So what we saw surface, we knew was already there. It was nothing new. Now, COVID-19 shined a light on it. So were we surprised? No, it was always there, and it's always been there. Kind of like I said on the interview, when I talked about after George Floyd, was murdered. There have been many George Floyd. There have just been some people who were late to the party. As I said, that it's nothing new. How did it affect the trauma? Well, it didn't help. You know, and so, and once again, you know, this is why we're in a place where we're looking for the proper fit to be able to have Black folks and folks of color be able to seek some therapy.
Thank you. Dr. Dempsey, go Techman. Not really, because I'm a demo girl. I'm just reading the. I'm just reading.
I understand. I
Okay.
understand.
Okay.
I understand.
Dr. Dempsey, Techman. I grew up in Portland when it was a sleepy white small city. I now work for an agency that is moving towards becoming an anti-racist organization.
Yeah.
Yay. How do I bring my white colleagues on this journey when they have been used to being the dominant group and now are feeling threatened by diverse voices expecting equity?
Take your power and your privilege in the room and have those conversations. And when they get a little comfortable, understand that that's a small slice of what people of color experience all of the time. It is incumbent upon you to continue to have those conversations and be an advocate.
Okay, in addition to your own practice, can the speaker suggest additional resources for finding a Black therapist in Oregon who is working from a culturally specific and sensitive lens? We have several of those questions in here. Like, is there a list also for finding a Black therapist in the area or therapists of color who will be accepting patients? It is truly needed. Rachael and Dr. Dempsey, that's on both you guys.
So there is a list, and every time I send that list out, everybody says, I know everybody on this list, and I've called everyone, and folks are busy. So that goes back to, you know, our original problem. That goes back to, you know, what one of the other persons said, you know, we need more folks who are culturally sensitive, culturally responsive to be able to do this work. And the more I hear questions like that, the more I'm understanding that's the work that needs to be done.
Great. Rachael, do you want to add to that too as well?
I think that speaks to the systemic work that needs to be done and creating a pathway for folks to move throughout the training, for us to be investing in folks who, you know, are healers throughout their journey. I mean, it's a long-term investment, right? And thinking about how you support people's education and schooling, and also we wrap around a variety of in addition to therapists, other social support. So I think that's the systemic issue, and it has multiple different levels, from funding to making sure that folks have access to the education that they need, the services that they need to get through. And I think, you know, what I like about you know, Dr. Dempsey and talking about the work is that even opening the eyes of folks of like, maybe I do want to be a therapist, right? Maybe, yeah, I could see myself doing that. So I think all of these conversations are helpful, and we're now at getting more investments, but then there's the specific strategies for folks of color, therapists of color, and our system is on the, you know, behavioral health side is in shorter supply than we would want it to. So that's definitely top of mind.
This one's for you, Dr. Dempsey. I am a person of color who is also a uniformed officer. Are there trainings for someone like me to help our people out while they are under a crisis?
And someone like, I guess I'm not understanding what that means. Serena, do you have an idea?
I would think because they're a uniform officer, and, you know, sometimes when you see a uniform officer, you know, a lot of folks don't want you to help you no matter what color you are, because the color is blue, right?
Absolutely. Okay, so
blue or brown. There's some brown uniforms too. So
right. Okay. So trainings, you know, none that I know of offhand, but I'm sure that there are some that exist, and I'm sure that there are teams out there, culturally sensitive teams, that can speak to that. So once again, whoever that is, if you can reach out to me, I will do my best to connect you with something or someone.
We only have 6 minutes left, and I would like each of you to take half of that. That's 3 minutes apiece, to really just end with some good some good words of wisdom. Your backgrounds are amazing. Rachel, what you do is just awesome. I'm so proud of you. And Dr. Keith Dempsey, you know, I love you. And I was wondering if I can get some cheap or free mental health. No, I'm just kidding. But we all need it. And I just really appreciate the work that you're doing, the work that you're going to do. So could you both take some time, and Rachel, I'll start with you, to really talk about the work that you're doing, the work that public health is doing. It's phenomenal, it's innovative, and you guys are starting to do some really great things.
Thank you for that. And just in some of the follow-up questions, if folks do want to, about the specifics and OHA, I don't work in the behavioral health side, but there are colleagues who do. And so I want to make sure if there are specific questions there that I link you with the right people. I mean, what stands out to me, and where I think the beauty is in this conversation, and it comes from the pain, and so I don't mean to trivialize it, but as Dr. Dempsey was talking about, and there was a question in there about COVID-19 and white rage, and as you were talking about, Dr. Dempsey, that this is nothing new for Black folks. The trauma there is nothing new, but the steadfastness, the keep on keeping on. There are so many tools, and just an attitude of general survival, and an attitude that comes with an attitude and skills and strengths that comes with never thinking this stuff was made for you, and never thinking that you would have all the answers. And so I think that really allows, and there's something that all of us can learn from Black folks about that ability to adapt, about the ability to come together and support each other. So when I think about, what's the positive things and what's the way out of it, it's the work that we're doing with community-based organizations, for example. Dr. Dempsey talked about a couple that he's worked with, whether that was African-American Health Coalition a little bit back in the day, or self-enhancement, or POIC, or just a variety of places. And so our work is bringing those folks into the conversation and allowing and creating that capacity for them to do the work in that way that already has trust, that's already those feet on the ground. And I think our most powerful work, we talk about at Oregon Health Authority, our strategic goal is eliminating health inequities. I'm a firm believer, I love the way you talked about centering Blackness, that those culturally specific strategies are the way to go, because when we start with community perspectives, community gives us a holistic perspective. It includes behavioral health and mental health and wellness. It includes socialization. It includes spiritual health. It includes physical health. And so when we start from that lens and ask communities, what do you need to be healthy, or what do we need to do? That's really, to me, the wave of the future. The opposite of that is us picking a disease that we're focusing on, picking an issue or a diagnosis, and then trying to solve for that. But when we start from that community perspective, in this case, looking at a Black specific perspective, or a certain part of the state geographic perspective, I think that's really where the innovation is, and that's where you get people contributing to their best.
Thank you, Rachel. And Dr. Dempsey, I'm going to give you a question to start with, and that'll be your last one, and then you can carry us on out. Given the stigma associated with mental health in the Black community, are there any intentional efforts happening related to virtual availability of mental health professionals?
In terms of virtual mental health professionals, we run into licensing. You would think, okay, because of COVID-19, okay, well, and now people are doing things online. Well, maybe you can see somebody in California, maybe you can see somebody in Louisiana, but you run into licensing. And I was really surprised to know that, even in places like Louisiana and Texas, the paucity is still the same. There is still a gap as it relates to African-American Black therapists. So, that's some work that needs to be done. I will say that there's some work that has been therapeutic. I have been doing a session. It's a monthly session for Northeast Fellowship. Pastor George Merriweather has allowed me to come along, my pastor, and we have just been doing this conversation. It's a conversation with Dr. Keith Dempsey about Black mental health, and folks just come on. It's just about 45 of us, and they just ask these questions. And what folks have said, it's been therapeutic because it has given them the permission to not be okay. It has given them permission to seek help. And it's kind of been like a group therapy kind of session. But we need to start looking at other things, whether it's group therapy, because individuals therapy, it doesn't feel like there's enough of us to go around.
And then before you do your last thing, is it okay for us to give out your email information so that we can share it with folks too as well?
Sure, absolutely.
Okay.
Absolutely. And
I'm gonna let you go ahead and close it on out.
Okay, and I'll just close it out with, there are a lot of questions around, hey, how do we do this, so on and so forth. And, and I'm glad that those questions are being asked. And I hope folks are asking those questions in the spirit of not getting an answer, but getting a direction to be able to dig a little deeper and to do their own homework. I'm reminded of a time when I was at George Fox. We were doing some work around our male privilege in our faculty, and our female colleagues, were telling us, and our male colleagues, how we do, we mansplain, and one of our colleagues, the sister said, because it just got to a point where, there were people saying, well, just tell us what to do. What is it? What is going on? And one of our sisters said, when we tell you, believe us. So that's what I'm asking. Okay, when folks tell you what this is, believe it. Don't look for the answer in them. Look for the answer in you. Dig deep.
Thank you so very much. This has been so beneficial.